Encourage the person to choose what he or she would like to wear. When assisting someone to dress and undress, be sensitive to modesty issues and try not to expose the body more than necessary. Larger size clothing, Velcro closures, elastic waistbands, zipper pulls, and big buttons can help make dressing and undressing easier. If someone has an injured, paralyzed, or weak arm or leg, always dress the injured arm or leg first and undress it last. The garment is most flexible at those times. To dress the upper body in a pullover top, insert your hand in the lower end of the sleeve, and as you hold his arm, slide the garment up the arm. Then pull the garment over the head. Guide the other arm into the sleeve.
When a person's in bed, it's actually pretty hard to change gowns. I think of a bed gown, a pajama, and it's really unnecessary to think that we have to get that pajama on as we normally did. Something that we do that's quite easy is to split the gown down the back. That way you just need to slip the arms through and you're not having to get it over their neck and around the back. It prevents injury to the shoulders. It prevents wrinkles from being around the backside that are hard to get out. It just makes everything easier.
To dress the lower body of someone who is in bed, place both feet in the pant legs. Then ask the person to lift his hips away from the bed as you draw the pants up. If the person is unable to lift the hips, roll him on his side and pull the garment up. To put on socks, gather the sock and draw it over the toes and heel. Check heel placement and make sure that the toes have room to move around. Then smooth any wrinkles. To help dress someone who can sit or stand, begin by having the person sit at the edge of the bed. To dress the lower body, place one foot at a time into the pant legs. Then draw the pants up over the feet and ankles. Help the person to stand and pull the garment up to the waist. For a shirt or blouse that opens in front, place your hand in the lower end of the sleeve and gather the sleeve up to the armhole. Holding the person's hand, guide the sleeve of the garment up over the person's arm to the shoulder. Then bring the garment across the back and with the second arm bent towards the head, guide it through the other sleeve, being careful not to pull on the arm. Clean and trimmed nails help prevent infection, odor, and skin injury. At least once a week, check the fingers and toes for ingrown nails, redness, cracking, swelling, or infection. Report any changes to the doctor or nurse. Always wash your hands and wear gloves when providing nail care. Fingernails are easier to clean after the fingers soak for 5 minutes in warm water. Soak the hands one at a time. When you remove the first hand from the water, soak the second hand. Then dry the hand well. Round and smooth the edges of the nails with an emery board. Then gently massage the hand with lotion. Shaving is a daily routine for most men. Never shave a person with a straight edge razor. Use a disposable razor, a razor with a disposable blade, or an electric razor instead. Never use an electric shaver if oxygen is in use, as sparks from the razor could cause a fire. If the person is on blood thinners, check with the doctor or nurse for any special shaving instructions. Help the person sit as upright as possible. If dentures are worn, be sure they are in place before shaving. Place a towel across the chest beneath the chin. To soften the beard, place a warm washcloth on the face for 2 to 3 minutes. Then apply the shaving cream and lather. Hold the skin taut by pressing and pulling the skin up toward the ear. Shave over the cheeks using gentle pressure and short, even strokes, moving the blade down in the direction that the hair grows. Rinse the blade as needed. To shave the upper lip, have the person press both lips together to make the upper lip taut. Then shave from the nose to the upper lip in short strokes. Shave the chin by keeping the skin taut and use short, even strokes. Shave the neck by bringing the razor up toward the chin. Rinse the blade in warm water as needed and change the water if necessary. If the skin gets nicked during shaving, apply a piece of tissue with a slight pressure to stop the bleeding. Use a warm face cloth for the final rinse and pat the skin dry with a towel. An electric razor is used on clean skin only. No additional water or shaving lather is needed. Shampooing increases circulation, cleans the hair and scalp, and brings a sense of freshness and renewal. Dry and no-rinse shampoos are available and eliminate the need for water. Simply follow the directions on the label. For most people, washing the hair with water is more enjoyable. Position the person on the side of the bed you will be working from, then place a waterproof sheet beneath the head and shoulders. Place a bath blanket over the plastic. Then position the shampoo tray under the head, with the end of the drain hose in a bucket or large wastebasket. Be sure that the shoulder area is covered so that the person remains warm. Remove any hearing aids or eyeglasses and place them in a safe and dry place. Place a dry face cloth over the eyes to protect them from water and shampoo. Test the water temperature on your wrist. It should be about 100 degrees Fahrenheit. Using a pitcher, pour water over the hair. When the hair is wet, apply a small amount of shampoo. Lather well from front to back by rubbing with the pads of your fingers. Massage the scalp for a few minutes to increase circulation. When you are finished, rinse the hair well. Support the head as you remove the shampoo tray. Then wrap the hair in a towel. Use the towel to dry the hair as much as possible. When combing wet hair, be especially careful because it is more elastic and fragile than dry hair. A large tooth comb works best. If you use an electric hair dryer, choose the coolest setting to avoid burns. Never use an electric dryer when oxygen is in use because of the potential for fire. Always check with the person how he or she would like you to dry and finish the hair. When you are finished, remove the bath towel and plastic covering. Reposition the person to the center of the bed. Leave the shampoo tray inflated until it is dry. Remove gloves and wash your hands. The procedures we have shown you for providing personal care are widely used and accepted, but sometimes a procedure must be adjusted to fit a particular situation. That's okay as long as you apply the principles behind it, such as working from clean to dirty, or infection control and hand washing, or the principles of body mechanics when moving or lifting. Personal care is important to our health and well-being. When we provide care in a gentle, thorough way, we help the person to feel better, and we honor that person's dignity.